This question is from Sam. Hello, I'm studying sports massage and currently have assignment to indicate how I would treat some common running injuries, one of which is hip bursitis. Could you please recommend how you would approach this condition as a therapist? Many thanks, Sam. Well, with hip bursitis, the biggest problem with hip bursitis is they're really having if it's really inflamed that day. More than likely, you don't want to do a lot of actual massage. Stretching might be more beneficial than actual massage, but otherwise, if it's more in the subacute stage, if it's not acting up as bad, myofascial release might be a really good beneficial kind of treatment to use. Just because you don't want to go full out and deep right around the bursitis, of course, right around the greater trochanter, the femur, that's where the bursa sac is, of course, but we're not going to use a lot of pressure around there, but that's why myofascial release might do a lot better, and then also a lot of stretching involved in those regions would help it out and wouldn't aggravate it as much as just regular deep tissue massage and stuff. But you can treat the areas around that area, of course, with deep tissue, but again, not on it. Definitely if they are having more of a act up or a flare up, you don't want to go after that, of course, with deeper work. So again, myofascial release, if you learn that, it'll be really beneficial. Also, again, stretching in that area. But maybe with stretching, do a lot of stretching of bringing the leg over the other leg when they're in the supine position to help stretch that area out. Otherwise, if they are in the prone position, you can kind of push into the sacrum area and lift up the foot and kind of move it back and forth and stretch out that area too. Or another option too is when they're in the prone position, cup the hip right at the ASIS. You hook that area, and then you lift up on that, and then you push down in the lower back. But you have to reach to the opposite side, of course, of the body. But just to help stretch that out more if it's in the lumbar area, if they have any problems in there. But again, let me see what else. Yeah, that's how I myself would treat it. But if you know anything with muscle testing, it might be a good idea to do some muscle testing beforehand, so you can kind of isolate if they are having a really bad time with that area. Otherwise, ask them how they're doing on a pain scale of 1 through 10, and if they're at like a 7, 8, or 9, or really painful that day, try to use some other kind of options instead of directly pushing on that area, because again, you don't want to aggravate anything with the bursa. And basically, again, bursa, it's an inflammation of the bursa, and a bursa is kind of a sac in those regions of joint regions, and it helps protect it. So that's my advice. And anybody else has any other kind of things that they've used for hip bursitis, or any kind of other bursitis in general too, please leave in the comment section below. Thank you.